Hi friends, once again welcome back to the Nurse channel. So as you all aware that we have started a new series named the NIMHANS series, and it is aimed at cracking the upcoming NIMHANS Nursing Officer Recruitment Examination, which is scheduled on December 17th, Sunday. So in our previous videos, some of our subscribers, they have raised a query like how the pattern of questions will be there for the NIMHANS examination. So based upon some experiences and based upon some information that we have collected from the contestants who have appeared for this examination, the pattern I'll be explaining now. So you know that NIMHANS is a hospital where it's a super specialty hospital for neurology, neurosurgery and psychiatry. So nearly 50 to 60% of the questions, okay, keep in mind 50 to 60% of the questions can be asked from neurology, neurosurgery, psychiatry and psychology topics. Okay, so the mixed will be asked from neurology, neurosurgery and psychiatry questions will be there for nearly 50 to 60%. Then from the other medical surgical nursing topics, we can expect a weightage of nearly 20% of the questions. Okay, 20% of the questions, and that questions also it will not be much deeper. Okay, it will not be much deeper, and if it is one or the other way, if it is related to the neurology, then like that questions can be expected. So I will be explaining some questions in this session, so you will get an idea of that. Okay, so nearly 20% of the questions will be from the rest of the medical surgical nursing topics, and the remaining questions will be from the foundations of nursing. Okay, and the foundations of nursing, which includes infection control also. Okay, infection control also is an area that you have to refer, and along with that foundations of nursing which are pertaining to neurology areas will be asked more. Okay, so in short we can tell 50 to 60% we can expect from the neurology, neurosurgery, psychiatry and psychology topics, then nearly 20% from the medical surgical nursing topics from the other systems, then the remaining nearly 20 to 30% we can expect from foundations of nursing, including infection control questions. Okay, and sometimes along with that you can expect general knowledge questions also, and the last time and all nearly less than 5 questions, sometimes it will be 3 questions, sometimes 2 questions, sometimes 5 questions. Okay, so less than 5 questions will be from the general knowledge also, general knowledge questions, or the current affairs also can be asked. And sometimes the questions from nursing education questions are comparatively less, but from the administration and the nursing research also you can expect very minimal questions, like 2 or 3 questions can be expected. Okay, so this is the usual pattern, but sometimes we can't expect in 1 year OBG, some nearly 10 to 12 questions were asked from OBG itself. Okay, so more you have to concentrate on neurology, neurosurgery and psychiatry questions. Okay, so this will be the pattern of the questions, and in this video also we have nearly 15 questions that will explain to you how the question pattern of the NIMHANS will be. So watch the questions and watch the answers till the end. This video should be watched till the end, because the explanations are also very very important, and questions can be asked from those areas also. Okay, so I request everyone who are watching this video without subscription, kindly subscribe and support us, and enable the bell icon so that you will be notified whenever we are uploading the new videos. Okay, so straight away without losing time we will be moving on to the questions in the series. So NIMHANS series, we will see these questions.
So the first question for you in this new series. So the question in the screen right now: a stroke patient has issues with understanding speech. What type of aphasia is this patient experiencing, and what area of the brain is affected? So here you have to answer for 2 questions. So first of all, the key point in this question is the patient is having issues with understanding speech. So this aphasia is experiencing at which area of the brain is affecting, and what type of aphasia is this? Okay, so the options for you are option number A, expressive aphasia, and the area is Wernicke's area. Option number B, receptive and Broca's area. Option number C, expressive and hippocampus, and option number D, receptive and Wernicke's area. So what is the answer? So we are starting with a very informative and important question. So the answer for this option is for this question is option number D, that is receptive or it is affecting in the Wernicke's area. So we'll have a small understanding about what are the two aphasias we have to discuss in this session and the respective areas. So first of all, expressive aphasia, or otherwise known as the Broca's aphasia, it is a condition where someone can understand the speech but has the difficulty speaking. So they can understand what others are speaking, but they have the difficulty to speak, that to express. So people with expressive aphasia may have trouble saying or writing words, speak in short phrases, and leave out small connection words. Okay, so that is expressive aphasia. So Broca's area is the region of the brain that is responsible for the speech production and control. So it's located in the left hemisphere of the frontal lobe, specifically in the posterior inferior frontal convexity of the neocortex. Okay, so in the left hemisphere of the frontal lobe, that is very, very important. And this Broca's area is responsible for the speech production and control. And at the same time, receptive aphasia, otherwise known as the Wernicke's aphasia, it is a condition where someone can hear the speech or see the words but has trouble understanding them. Okay, so here the understanding of the spoken speech or the words they are seeing is difficult. So people with receptive aphasia may have trouble understanding what is being said, then have the trouble understanding the written words. So say many words that don't make sense, they will use the wrong words, and they will string together a series of meaningless words. Okay, so these are the characteristics of the receptive aphasia. So Wernicke area is located in the Brodmann area 22. Brodmann area 22, the posterior segment of the superior temporal gyrus in the dominant hemisphere. Okay, so Broca's area already we have explained. This is the area of Wernicke area in the brain, and it is in the superior temporal gyrus in the dominant hemisphere. So we know that 95% of the people have a left dominant hemisphere. The Wernicke area is usually found on the left side. Okay, so from this question you are getting information regarding many things. Okay, so Wernicke's area controls the ability to understand the meaning of the words. Okay, while the Broca's area within the motor cortex controls the ability to speak those words. Okay, so these are the difference between Wernicke area and Broca's area, and it functions together for the production understanding of the speech. Okay, both areas, Wernicke's and Broca's. Okay, so with this question you are getting many information, and with that question we will move on to the second question in the series. So the question is, which action is essential when cleaning the area around a Jackson-Pratt wound drain? So here the question is regarding the cleaning of a drain. Okay, here they have mentioned like Jackson-Pratt wound drain. Okay, so how will you clean? So the options are option number A, cleaning from the center outward in a circular motion. Option number B, removing the drain before cleaning the skin. Option number C, cleaning briskly around the site with alcohol. And option number D, wearing sterile gloves and a mask. So what is the nursing action, essential nursing action in a patient while you are cleaning the Jackson-Pratt wound drain? So what is the answer? So you have to think the basic infection control practice what we have to use while cleaning any surgical wound or the surgical drain. Okay, so the answer is option number A, that is cleaning from the center outward in a circular motion. Okay, so we will be discussing about this question. So first of all, what is a JP drain or the Jackson-Pratt drain? It is placed during the surgery to remove excess fluid or blood from the surgical site. Okay, same like our Romovac drain after the surgeries we used to put now. Okay, so it is a closed airtight drainage system that operated by self-suction. So that is the principle of that JP drain. So keep aside the JP drain. So we will come to the basic thing, that is a cleaning of the surgical wound or the drain site. So we should always clean around a wound drain moving from center outward in ever larger circles because the skin near the drain site is more contaminated than the site itself. Okay, so that is a principle, basic infection control principle, and the nurse should never remove the drain before the cleaning the skin. Okay, so the purpose of the drain itself will go away. Then alcohol should never be used to clean around a drain, and because it may irritate the skin and has no lasting effect on the bacteria because it evaporates. Okay, so that is that's why we should not use alcohol. And finally, the nurse should wear sterile gloves to prevent the contamination, but wearing a mask is not necessary while cleaning a surgical drain. Okay, so these are some tricky things that you can mistaken. So these are some important points regarding the cleaning of a drain based on the infection control practices. Okay, so like these questions you can expect in NIMHANS examination. So the next question, which among the following is wrong about carbidopa-levodopa combination drug? So you know that why carbidopa-levodopa is given for which disease condition. So here the question is regarding what is wrong about this drug. So that's the question, and the options are: option number A, it can take up to 3 weeks to notice a decrease in the signs and symptoms after starting the treatment. Then option number B, the body fluids can turn a dark color. Then option number C, it is commonly prescribed with a vitamin B6 supplementation. And option number D, levodopa is able to enter the brain. So what is wrong about carbidopa-levodopa? So what is the answer? So the answer is option number C, that it is commonly prescribed with a vitamin B6 supplementation. That is wrong. Okay, so why it is wrong and what are the other things that we have to learn about carbidopa-levodopa will be explaining now. So levodopa, you know that it is converted to dopamine via the action of a naturally occurring enzyme called dopa decarboxylase. So before that, levodopa-carbidopa combination we are giving for the treatment of Parkinson's disease. So I am explaining now, levodopa is converted to dopamine via the action of the naturally occurring enzyme called as the dopa decarboxylase. So this occurs both in the peripheral circulation and in the central nervous system after the levodopa has crossed the blood-brain barrier. So activation of the central dopamine receptors improves the symptoms of Parkinson's disease. So in short, I can explain to you like the dopa decarboxylase is a natural occurring enzyme that is found in the body, and this can convert the levodopa into dopamine. Okay, and this is happening both in the peripheral circulation and also in the central nervous system circulation, and this levodopa has the ability to cross the blood-brain barrier. Okay, so that much is clear for you. Now what is the role of carbidopa? This carbidopa, it cannot cross the blood-brain barrier, and however it prevents the peripheral conversion of levodopa to dopamine and thereby reduces the unwanted peripheral side effects of levodopa, and at the same time the use of the carbidopa increases the quantity of levodopa in the bloodstream that is available to enter the brain. So in short, I can explain like this carbidopa, it cannot cross the blood-brain barrier, and at the same time what they will do is it will prevent the peripheral conversion of the dopamine, peripheral conversion of the levodopa to dopamine by the dopa decarboxylase. Okay, so thereby what is happening, the levodopa will be available for the central nervous system and the breakdown will happen there, and dopamine will be released, and it will reduce the symptoms of Parkinson's disease. So this is the mechanism. Okay, so we will come to the question. So the patient should avoid foods and supplementations which is high in vitamin B6. Why? Because it decreases the effectiveness of this medication. Okay, so vitamin B6 supplementation above 5 to 10 milligram per day reduces the effectiveness of levodopa. Okay, so the levodopa action will be reduced with the vitamin B6 supplementation, and it should be limited. The vitamin B6 supplementation should be limited to 5 to 10 milligram per day. Okay, so I think that is clear for you. Now we will be moving on to the fourth question in our series. Which among the following seizures appear as the patient is daydreaming? So patient will be look like daydreaming. There will not be no jerky movements. There will not be no seizure activity. Then what type of seizure it is? That is a question. Simple question. So the option is option number A, clonic. Option number B, atonic. Option number C, tonic. And option number D, absent seizures. So what is the answer? So the answer is option number D, that is the absent seizures. So we'll have a small explanation about the seizures what I have explained in the option. So the daydreaming, like it is an absent seizure and it is most common in the children. Okay, so the hallmark of it is staring, that appears to be like a daydreaming state. So staring look will be there and you'll be thinking like the patient is daydreaming. Okay, and it is very short, and the post-ictus stage of this type of seizure is immediate. Okay, so the duration of the seizure is very short, and the post-ictus stage, so stages of seizures that you have to see later, so that post-ictus stage also is very limited in this absent seizures. So the absent seizures, otherwise known as the petit mal, otherwise not, it was previously known as the petit mal seizures, and these are the brief seizures that cause a lapse in the consciousness. So they can happen suddenly without any warning, like that aura and all will not be there. So the symptoms of an absent seizures include blank stare will be there, unawareness will be there, and stopped speech. Patient will be talking and suddenly patient stops talking and will be staring and looks like daydreaming. So that these are the characteristic features of absent seizures, previously known as the petit mal seizures. Okay, so on the other side, atonic seizures are a type of seizure that causes sudden loss of muscle strength. Okay, so here there will be sudden loss of muscle strength, and these seizures are also called as the akinetic seizures, then drop attacks or drop seizures. Okay, so there will be akinetic seizures. It is also known as akinetic, otherwise known as the drop attacks or the drop seizures, and the sudden lack of muscle strength or tone can cause the person to fall to the ground. Okay, so suddenly patient will fall to the ground, and one more information, so the first part to hit will be always the head. So the patients with the atonic seizures are advised to wear helmets all the time. Okay, so a tonic seizures or tonic clonic seizures, the other one is a tonic clonic seizure, and previously it was known as the grand mal seizures, which involves tonic stage and clonic stage. So the tonic stage is characterized by loss of consciousness, stiff body, possible fall to the floor, and the clonic stage includes the jerking limbs, possible loss of bladder or the bowel control, possible biting of the tongue or the cheek, and possible difficulty breathing. Okay, so both tonicity and clonic features are there in the tonic clonic seizures. Okay, so you are getting a very peripheral knowledge regarding the tonic seizures, clonic seizures, and absent seizures, and in depth you have to go through these topics. It is very important in exam point of view, that is epilepsy. Okay, so we'll be moving on to the fifth question in our series. So the question is, which among the following is a bladder emptying drug which can be used in multiple sclerosis? So in multiple sclerosis there are chances that we will be explaining. So in that, if the bladder emptying is not happening, then which is the drug of choice? Important question, previously asked also. So the question is options are option number A, bethanechol, option number B, oxybutynin, option number C, avonex, and option number D, amantadine. So what is the answer? Bladder emptying drug. Bladder emptying drug. So we know that there are bladder emptying drug for overactive bladder. So that we will be seeing in the explanation. Before that, the answer for this question is option number A, that is bethanechol. Bethanechol. Okay. So we know that bethanechol, it is a parasympathomimetic choline carbamate drug that selectively stimulates the muscarinic receptors without any effect on the nicotinic receptors. So it is stimulating the muscarinic receptors in the bladder, that is in the detrusor muscle. So this medication, it is a cholinergic medication that will help with bladder emptying. Okay, bladder emptying. So dicyclomine hydrochloride was the drug of choice for detrusor hyperreflexia, and bethanechol chloride for the hypotonicity, and dandrolene sodium for the somatic dyssynergia, and phenoxybenzamine hydrochloride for the sympathetic dyssynergia. Okay, so you are getting many information from a single slide. So dicyclomine hydrochloride was the drug of choice for detrusor hyperreflexia, that is overactive bladder. Then bethanechol, that oxybutynin also is there, that I will be explaining. Bethanechol for the hypotonicity. Okay, and then phenoxybenzamine for the sympathetic dyssynergia. Okay, so along with that, oxybutynin, another important drug. It is a medication which is used to treat the overactive bladder. So this you have to keep in mind. Oxybutynin is a drug of choice for the overactive bladder. Then amantadine, so it is a medication which is not using in multiple sclerosis. It is used in the Parkinson's disease to treat the dyskinesia associated with Parkinsonism and influenza caused by type A influenza virus. And another drug was the Avonex, and the chemical name is the interferon beta 1A, and it is a medication which is used to treat patients with relapsing multiple sclerosis. Okay, relapsing type of multiple sclerosis. So these are the other options I have explained. Oxybutynin is the overactive bladder, amantadine to treat the dyskinesia, Avonex is a medication to treat with the patients with relapsing type of multiple sclerosis. Okay, so again another important question, and so many information I think you got from this question. Moving on to the fifth question in our series. So what is the relation between increased PaCO2 and ICP? That is a partial pressure of carbon dioxide and ICP. So what is the relationship between these two? That's a question. And the options are: option number A, it causes vasoconstriction and decreases the ICP. Then option number B, it promotes diuresis and decreases the ICP. Then option number C, it causes vasodilation and increases the ICP. And option number D, it causes vasodilation and decreases the ICP. So slightly confusing. So what is the role of partial carbon dioxide in the ICP maintenance that you have to understand? So the answer for this question is option number C, that is this increased partial pressure of carbon dioxide can cause vasodilation and thereby increasing the ICP. Okay, so we'll have an explanation. So an elevated carbon dioxide level in the blood will cause vasodilation. Okay, so elevated carbon dioxide level causes vasodilation, not constriction, which will increase the ICP. So normal ICP is 5 to 15 millimeter mercury. So therefore many patients with severe ICP may need to be mechanically ventilated, so the partial pressure of carbon dioxide levels can be lowered. Lowered means like 30 to 35, which will lead to vasoconstriction and thereby decreasing the ICP. Okay, so don't be confused. With constriction, there is less blood flow, volume and blood flow going to the brain, and this will help in the decreasing the pressure. Okay, so just think about the Monro-Kelly hypothesis of ICP, this one, and you can answer this question very easily. Okay, so always we will tell like pressure will be decreasing when there is a dilation, but in ICP that is different. When there is a dilation, there will be increased blood flow to the brain, and that can result in the increased ICP. So here, because of this reduced partial pressure of carbon dioxide will cause the vasoconstriction, so blood flow will be reduced and thereby will reduce the ICP. Okay, so that is regarding that question, ICP and partial pressure of carbon dioxide, and what is the need for mechanically ventilating the patients with increased ICP. Okay, so moving on to the sixth question in our series. Which nursing action is essential when providing continuous enteral feeding? Okay, so what is enteral feeding, you know? So which nursing action is essential? So this question seems to be very simple, but the options and its explanation is important. So first of all, we will see the options. First of all, elevating the head of the bed. Option number B, positioning the patient on the left side. Option number C, warming the formula before administering it. And option number D, hanging a full day's worth of the formula at one time. So which is the essential nursing action? So the answer is, you know, simple question, option number A, elevating the head of the bed. So the other options and why it is not promoted, that things we will be discussing now. So we know that elevating the head of the bed during the enteral feeding minimizes the risk of aspiration and allows the formula to flow into the patient's intestine very easily. Okay, so when such elevations are contraindicated, then that time we have to position the patient on the right side, not on the left side. Okay, so we can expect question like, if the patient is contraindicated to be positioned in a elevated position, especially that pneumocephalus cases used to come in the neurosurgical ICUs. In that conditions, we can't give much head elevation. In that conditions, we have to position the patient on the right side while giving the feed, not on the left side. Okay, so the nurse should give enteral feeding at room temperature. So you should not warm the feed before giving to minimize the GI distress. Okay, room temperature we have to give, and to limit the microbial growth, the nurse should not hang more feed at the same time. So whatever we have to give for that particular time, that one need to be infused. Okay, so that's all regarding that question. I think again some more information you are getting out of this question. Now moving on to the 7th question, a simple question: which statement about a stethoscope is true? Okay, so here the parts of the stethoscope is asked. So the bell of the stethoscope detect the high pitched sounds best. Option number B, the diaphragm detects the high pitched sound best. Option number C, the bell detects the thrills best. And option number D, the diaphragm detects the low pitched sounds best. So the bell and the diaphragm, and what is the use of bell and what is the use of the diaphragm, that is being asked in this question. So which statement is true regarding a stethoscope? So the answer is option number B, that is the diaphragm detects high pitched sounds best. Okay, so we'll be seeing each part. That bell, so it is a smaller and concave, and the bell is used to capture low frequency sounds like hard murmurs, and the bell is used with light skin contact. Okay, very low frequency sounds can be heard with the bell. Okay, and coming to the diaphragm, it is larger and flat, and the diaphragm is used to listen to the high frequency sounds like breath sounds, bowel sounds, the normal heart sounds, etc. Okay, so the diaphragm is used with the firm skin contact. Okay, you have to give a slight pressure and we have to auscultate properly. Okay, and what about the thrill? The palpation, not with the auscultation, the palpation itself will detect the thrills best. Okay, so again, and some important points you are getting out of this question. Now we will be seeing the next question, that is the 8th question in the series. Which response by the nurse is most likely to reduce the patient's anxiety? Okay, so the patient is anxious, and what response from the nurse is the best response to reduce the anxiety of the patient? Okay, so I am giving you some statements. So the first statement: everything will be fine, don't worry. And option number B, read this manual and then ask me any questions you may have. Option number C, why don't you listen to the radio? And option number D, let's talk about what is bothering you. So among the statement, which statement suits to reduce the anxiety of a patient? So the answer is option number D, that is let's talk about what's bothering you. So we have to focus on the problem of the patient. Okay, so that is the answer. So anxiety, it may result from feeling of helplessness, isolation or insecurity. So this response helps reduce the anxiety by encouraging the patient to express their feelings. Okay, so the nurse should be supportive and develop the goals together with the patient to give the patient some control over an anxiety inducing situation. Okay, because the other options ignore the patient's feelings and block communication, they would not reduce the anxiety. So the last option, that let's talk about what is bothering you, means that we are going into the problem of the patient and we are asking, and we are not diverting the patient, and we are trying to get a solution to the patient's anxiety. What is the underlying cause for the anxiety? Okay, so that is an application level question. Okay, so moving on to the next question, that is the 9th question. Which factor makes geriatric patients to adverse drug effects? Okay, so why geriatric patients are more prone for the adverse drug effects? That is a question and the options are: option number A, faster drug clearance; option number B, physiological changes; option number C, increased amount of neurons; and option number D, enhanced blood flow to the GI tract. So what is the answer? Why elderly persons are prone for the increased adverse drug effects? Because of their physiological changes. Okay, so that's the answer. So we know that aging related physiological changes account for the increased frequency of adverse drug reactions, in geriatric patients. So renal and hepatic changes causes the drug to clear more slowly in these patients, and with increasing age the neurons are lost and the blood flow to the GI tract decreases. Okay, so that's the answer for this question. Simple, easy question. Now we are moving to the 10th question in our series. Which of the following planes divides the body longitudinally into anterior and posterior regions? Okay, so here the question is regarding the planes, and there are, you know that there are several types of plane, and the question is asking regarding the posterior and anterior region, how the body is divided posterior and anterior regions. Okay, so the options are option number A, frontal plane, option number B, sagittal plane, option number C, mid-sagittal plane, and option number D, transverse plane. So which plane divides the body into anterior and posterior region? So answer is option number A, that is the frontal plane. Okay, so I think I can explain it with the help of a diagram that I'll be explaining at the end of this question. So frontal or the coronal plane runs longitudinally at a right angle to a sagittal plane, dividing the body into anterior and posterior region. Okay, so frontal plane, otherwise known as the coronal plane, it runs longitudinally. It is like the longitudinally it is running, and it will be the right angle to the sagittal plane. Sagittal plane will be like this, and the coronal plane will be like this. Okay, so the coronal plane and the sagittal plane will be like the right angle to each other, and it will divide the body into anterior and posterior regions. And sagittal plane, it runs longitudinally, dividing the body into right and left. Okay, right and left regions, and if exactly midline, it is known as the mid-sagittal line. So I'll be explaining with the help of a diagram. And a transverse plane runs horizontally at a right angle to the vertical axis, dividing the structure into superior and inferior regions. Okay, so just I have an explanation with the help of this diagram. So this is the coronal or the coronal or the frontal plane, so that the body is divided into anterior and posterior. Okay, so this is the coronal, this one, that light green one. Okay, so anterior and posterior. Then this is the transverse plane that you can see here with the light green. So horizontal or the axial or the transverse plane, which divides into superior and inferior. And you can see another thing, that is a sagittal or the longitudinal plane, that is in the red color. You can see that is the right and the left division is happening with that. Then this is the median plane, and this is the parasagittal plane. Okay, so I'll leave it. So if this sagittal is happening in the exactly middle, then that is known as the mid-sagittal plane. Okay, so I think the diagram will explain to you very well regarding the planes. Okay, so that's all regarding that question. Now we'll be seeing the 11th question in our series. So question is, when examining a patient with abdominal pain, the nurse should assess in which order? Okay, so patient is having abdominal pain, so you are going to assess the patient. How? First of all, any quadrant first. Option number B, the symptomatic quadrant first. Option number C, the symptomatic quadrant last. And the final option, the symptomatic quadrant either second or third. So how you will assess the abdominal quadrant of a patient, and the patient is having abdominal pain? So the regular pattern of assessment I will be explaining now. Before that, we will be seeing the option answer for this question. So the symptomatic quadrant we need to check last. Why? That will be explaining now. So begin in the right lower quadrant. Normally we have to begin like in a clockwise direction, like begin in the right lower quadrant and then move the sequence up to the right upper quadrant, then left upper quadrant, and finally the left lower quadrant. Okay, so this is the way. Begin in the right lower quadrant, then into the right upper quadrant, left upper quadrant, and finally the left lower quadrant. Okay, so the nurse should systematically assess all areas of the abdomen. Okay, we should systematically assess all the areas of the abdomen, if time and the patient condition permits, concluding with the symptomatic area. Concluding, that means it is in the last. Otherwise, the nurse may elicit pain in the symptomatic area, causing the muscles in those areas to tighten. Spasm can happen, and this would interfere with the further assessment. Okay, so you have to do the assessment of the pain, assessment of the area which have the pain last. Okay, so that is a sequence of abdominal assessment. Now we will be seeing the next question in our series, that is the 12th question. So the question is, the most comfortable method of delivering oxygen to a COPD patient is the most comfortable method of delivering oxygen. So the options are option number A, cropet, option number B, nasal cannula, option number C, simple face mask, and option number D, partial rebreathing mask. So which will be most comfortable method of delivering oxygen to a COPD patient? Answer is option number B, that is a nasal cannula. Why? And the fractions and all we will see now. So high frequency nasal cannula or HFNC is used to treat chronic obstructive disease patients, and HFNC delivers a heated humidified air oxygen mixture to the patient, and it helps remove the secretions. We can easily remove the secretions, then it reduces the work of breathing, and it will be beneficial in treating acute exacerbations of COPD. Okay, so these 3 points please keep in mind. And the flow rate for a nasal cannula, it ranges from 1 to 6 liter per minute. Okay, flow rate is 1 to 6 liter per minute, and the oxygen concentration delivered is 28 to 44%. That much only is necessary for the patient, for COPD patient, because if you are giving a high flow rate, the problem is like you know that the respiratory center will be stimulated by the carbon dioxide. So if you are giving more oxygen, and there will be a problem with the brain stimulation, and thus patient condition can worsen. Okay, so that is why we are using the nasal cannula, and the range is between 1 to 6 liter per minute, and the oxygen concentration delivered is 28 to 44%. Okay, so this is a chart which can explain to you in each system, in each flow system, how much is the flow rate and how much is the FiO2. These are very important points, and you can omit the Venturi mask type, that blue adapter. These things you can omit, but the other thing like nasal cannula, the maximum is 24 to 44. Then simple mask, it will be 35 to 60%, and non-rebreather mask, it will be 65 to 95%. Okay, and partial non-breather mask, the FiO2 will be 60 to 90%. Venturi mask will be 24 to 60%, and high flow nasal cannula, it will be 21 to 100%. Okay, so these things please keep in mind, and how much liter per minute we can give, these things are very important. We can go through it later, and because we have time limit constraints. Okay, so that's all regarding that question. Moving on to the 13th question. So the question is, uncontrolled atrial fibrillation can predispose which type of stroke? Okay, so the patient is in uncontrolled atrial fibrillation, so what type of stroke this patient can get? So the options are option number A, hemorrhagic stroke, option number B, ischemic stroke, option number C, thrombotic stroke, and option number D, embolic stroke. Uncontrolled atrial fibrillation. So which are the types of stroke? You can answer this question easily. So the answer is option number D, that is embolic stroke. Okay, so again, important explanation regarding this question. A patient is in uncontrolled atrial fibrillation. They are at risk for clot formation within the heart chambers. So the clot can be formed in the heart chambers, and this clot can leave the heart and travel to the brain, and hence an ischemic embolism type stroke can occur. Okay, ischemia will happen, but the main thing is embolism. This ischemia is happening because of embolism, and that's why we have chosen it as an embotic stroke. Okay, and ischemic thrombosis type stroke is where a clot forms within the artery wall of the neck or the brain. Okay, so this is the thing that you should understand. If a clot is formed somewhere in the body, like heart or from the peripheral vasculature, anywhere, so and that clot is dislodging and traveling, that is known as, it will form as an emboli and can result in the embolic stroke. And if a clot is happening within the brain structures, within the brain artery wall, then that is known as the ischemic thrombosis. Okay, in both cases ischemia is happening. One is by thrombotic, by the form of block in the brain vessels itself, and other in the form of embolic. That means the clot is formed somewhere in the body and it is traveling to the brain and it is causing the ischemia by blocking. Okay, so that is the main difference. Okay, moving on to the second last question. We'll be seeing the second last question with the options in the screen right now. So the question is, which among the following explains cogwheel rigidity? Okay, cogwheel rigidity, and you know that in which condition cogwheel rigidity can be seen. So what is a cogwheel rigidity? So the options are option number A, the arms are slightly jerk. as passively move them towards the patient's body. Then option number B, constant resistance to motion throughout a joint's range of motion. Then rolling a small object between their thumb and index finger. And option number D, resistance to passive extension of the extremities. So which are the which one explain cogwheel rigidity? Among this option, what explains the cogwheel rigidity? So the answer is option number A. Answer is option number A. That is, arms slightly jerk as passively move them toward the patient's body. Option number A. So we will have an explanation regarding the cogwheel rigidity. Cogwheel rigidity, it is a common sign of Parkinson's disease. So the cogwheel rigidity is characterized by, first of all, regarding the movement, a ratchet-like movement that's similar to a ratchet wrench that hesitates before clicking forward. Okay, so exactly the movement it is like this, and the muscle response will be the muscle response with cogwheel-like jerks will be there to the use of constant force in the for the bending the limb, and the resistance will be the resistance that stops and starts and the limb is moved through its range of motion. Okay, so these are the characteristic features of the cogwheel rigidity. Okay, this is important. Then I have given many other options also. In that these are the types of other type of rigidity. So for example, first one is the lead pipe rigidity. Okay, so cogwheel rigidity already we have explained. Then what is a lead pipe rigidity? It is a type of movement disorder that causes the constant resistance to motion throughout a joint's range of motion. Okay, there will be constant resistance to the motion throughout the patient's range of motion, and it is a symptom of Parkinson's disease, and it is characterized by hypertonicity, constant resistance, and stiffness. Okay, hypertonicity means increased tonicity in all the muscles around the joint. Then constant resistance means there will be resistance to motion throughout the entire range of motion, and stiffness or inflexible muscles will be there. Okay, so this is the lead pipe rigidity. Okay, cogwheel rigidity and the lead pipe rigidity. Then other option, what is a pill rolling movement? Pill rolling tremor is a type of tremor that is often associated with Parkinson's disease, and it is a resting tremor that makes it look like someone is rolling a pill or small object between their thumb and index finger. Okay, so these are the resting tremors can be seen in Parkinson's disease. Okay, so I think with that second last question, you are getting information regarding the cogwheel rigidity, then lead pipe rigidity, and pin rolling movement. Okay, so coming to the last question in this series, and another interesting question. The infant of a substance abusing mother is at a risk for developing a sense of which of the following? Okay, so slightly applicable, but quite interesting question. Infant of a substance abusing mother is at risk for developing a sense of which of the following? So the options are option number A, mistrust, option number B, shame, option number C, guilt, and option number D, inferiority. So just think about a theory, and it is shown like in the question it has mentioned like it is an infant, and a course also is written there is a substance abusing mother. So that infant will landed up in option number A, that is a mistrust, that trust versus mistrust. Okay, so that is the thing that we have to think about this question. So according to Erickson, infants need to have their needs met consistently and effectively to develop a sense of trust. Okay, so here the infant whose needs are consistently unmet or who experiences a significant delay in having them met, such as in the case of an infant of a substance abusing mother, will develop a sense of uncertainty leading to mistrust of caregivers and their environment. Okay, so from psychology, these type of theory, Erickson's theory is very important, and other theories also you should go through. Okay, so that with that question we are coming to the end of this section. So we have seen nearly 15 very important questions which can be asked in the upcoming examination. So share about this platform to your nursing friends. Keep in touch with us so that you will be notified whenever we are uploading the new videos. So see you soon with another set of questions. So prepare well. All the very best for the upcoming examination. Signing off.